I'd now like to turn back to my namesake, Brian Behlendorf. Brian, a lot we've already discussed here in the earlier part of the day and here as well, this concept of privacy and security. How can I, as an individual, be and issue one of these digital vaccination certificates? How do I think about my health data privacy and the security of that health data as I might share that with a bar owner or a restaurant owner as I seek to get back to the new normal?
Yeah, well, thanks, Brian. We do have to be really careful here. And I know privacy and security seem like very abstract and remote concepts to average consumers, but let me try to put it this way: if we normalize the frequent sharing of signed clinical health data out there in the world, we need to be super careful and go above and beyond what we think might be appropriate in the specific circumstance of this pandemic or a use case into the kind of things that might happen well beyond this point. And to try to illustrate this, I want to go back 26 years ago. I apologize, I'll try to keep the story short. Back to the invention of the cookie header in HTTP on the web. I was there with, it was an online list. We were talking about the HTTP standard. We were talking about the need to preserve state from one connection to another. We came up with a header called state, which got renamed cookie later, to basically say, here's some data that we could store in the browser that the consumer would know about. They'd know this data is associated with them and this website, and there'd be consent built in. They'd accept that, and then they'd know when it was represented each time they visited the website. And it'd be a way of being familiar, you know, the same way you might put on a jacket when you go to a ball game or something. But eventually, when that got implemented, every website wanted to not store some useful information that was human readable, but this weird barcode like cookie thing, right? And eventually that, you know, that frequent reminder, do you want to accept this? Do you want to accept this? You know, first Netscape added the little checkbox that said, oh, just accept it all the time, you know, and then they made that the default so that you didn't even know when cookies were being set when you visited a website or not. It just the browser automatically accepted it and away you go. And that was really shocking to those of us who like started out from a position of consent, a position that, you know, there's a balancing act to preserve here. So to translate this forward, you know, when you think about presenting your driver's license to a bartender so that, you know, she or he will serve you a drink, you don't sit there and think about, like, you know, is this bartender going to write down my date of birth? Are they going to write down my eye color and my weight and that kind of thing, all the information that's on that thing to help bind it to me as an individual? But in a digital circumstance, that kind of collection of that data and the recording of it is frequent and omnipresent, is done all the time. We also know that there's a lot of ways to reverse from data that we think is innocuous, that we think is stripped of PII. Things like the batch number of the vaccine that I got, you know, that's on my white card, right? That I believe is also on my CA card, which Rick, I did go and get. I'm one of those 2 million who downloaded. Is there a way to reverse that to where I got my shot, to where I live, to other circumstances? You know, there's some danger here. And I think it's really important to have this horizon that Dakota talked about, this distinction between signed clinical data, where you want that to be complete, you want that to be verifiable, you want that to be something a doctor can look at and know that it's got everything it needs. And health pass data, which needs to be minimized, which needs to be use case specific. Perhaps it does have an expiration date on it. Perhaps it has this kind of limiter to it. And this is important for us to think about now because we're establishing new norms. What we come up with here as a system will get used beyond the pandemic. It'll be used in other circumstances. And hopefully, because I actually am a fan of the idea of having spaces that I know everyone in that room is vaccinated. I want to use these things. But so often as technologists, we've kind of said to ourselves, look, we'll just build the plumbing. We'll let the optionality, you know, we'll maximize for optionality. We'll let the policymakers decide what's right or wrong. Unfortunately, that does often lead to outcomes like what we saw with cookies on the web, where that presumption of anonymity, that presumption of safety was kind of vanquished. So this is why I think we need to be careful now in what we're adopting. And I think the first wave of apps here, I think, should eventually give way to a second wave that does have this distinction between signed clinical data and use case specific health passes.
I really appreciate you kind of teeing up that next part of this, Brian. So I asked Claire if you could go ahead and pull up the slide for me. Just to build off of a little bit what Brian just shared, I wanted to share this framework because I think it gets to a lot of what we've been talking about, the concept of a foundational smart health card or some kind of verified record of your vaccination, and then some of the derivative products that can be generated from that can be more secure in your privacy, preservation, and health data. And so let me just briefly walk through this with you. And just as a disclosure, so I'm one of the co-founders of the Vaccination Credential Initiative. I've had the pleasure of leading that as a purely voluntary effort with a number of the participants that you've been listening to for the past couple of days. So in VCI, and I believe in many of the other efforts that we've been hearing about, there's this framework of issuers and verifiers, and the individual owner of that health record, of that vaccination credential, sits in the middle. And so on the left-hand side are the data sources. These are the organizations that have actual records of administration of vaccination as health systems, or it might be a state registry that in partnership with that health system gets a record of that vaccination. These are the organizations that we're commonly referring to as issuers of credentials. They can be hospitals, pharmacies. Rick was mentioning Walgreens and Walmart and CVS. They can be labs. They can be health plans and payers. Many of the large ones are leaning into this: Cigna, Evernorth, Humana, United Healthcare. And of course, they can be state registries. We've heard great examples from California and New York, and as well as Quebec and the state of Louisiana as well. That card is then issued. It can be either, again, in the Smart Health Card framework, held as a paper copy that is verifiable, or as a digital copy with a QR code that is verified. And that then can be secured on your mobile device, on your wallet, digital wallet, be an application, or natively on one of the devices that you might have, be it Android or iOS. Now, what Brian was getting to is this important concept of you as the end user, as the consumer, as the owner of that record, can choose to take it, and if you want an additional layer of privacy securing technology, leverage a health pass. A secondary derivative product that can take that information, apply a level of business logic to that. We'll use Smart Health Card as an example, to issue a green or a red dot to determine if you're safe to enter into a specific area based on the destination's rules and logic. Some destinations may accept certain kinds of vaccination or have testing standards, be it 70 hours or 24 hours in advance. Each place can be different. And so that health pass and that verifier logic that can be applied on it, on top of it by the destination site, is an important additional layer of consideration. There is a lot of work in this space by many vendors to be partners to end users to issue those kinds of secure, privacy-preserving health passes, in addition to all the work that we're hearing about today around smart health cards. So I wanted to just to make sure that we understand the landscape of what's happening now, and I want to be sensitive to time. I know that we have a ton of questions coming in from the audience, so really appreciate that. I'm going to ask one last question of Rick, and Rick, really, it's from your perch in the most populous state in the nation. Where do you see this going? It's starting with vaccination credentials. You know, we're talking about testing. IATA is doing a lot of work around testing and making sure individuals know how to get from one country to the next. So if vaccination and testing is where it starts, where's all this going with verifiable copies of your clinical record?
Well, I think in the most immediate term, one of the most interesting potential implications here is just for the portability of a patient's data across state lines. Like the number of my friends and folks who have reached out to me post the digital vaccine record launch, who flagged, hey, I got my first dose in San Francisco, but I was in Illinois when I got my second dose. So my CDC card is correct, but the California Immunization Registry only knows about one of my 2 doses. Currently, there's no scalable solution that allows the California dose to be registered in Illinois or vice versa. That alone would be a tremendous step forward for all of the states who want to be able to have a clearer picture of their residents. Certainly, as we've heard quite a bit about in the post-COVID reality, people are relocating. either coming into California or people from California going to other states, getting a way to equip individuals to have access to that information and then choose to register it so that the immunization registries themselves are more current, more accurate, more complete, I think would be fantastic. I think beyond that, there is nothing about either the Smart Health Card that VCI has helped promulgate that is COVID specific. So the fact that this could be for all immunization records. You can think of the yellow card that people now have to travel with when they go to certain countries. There's no reason that couldn't also be digital and portable and interoperable. I think that in the spirit of never wasting a crisis, this is an opportunity for us to recognize the tremendous value in having the ability to agree on a way to convey this information and then choose to interpret it for purposes that are beneficial both to the holder of that information and the issuers of that information.
Appreciate that, Rick. So the questions are coming in here. I know we're short on time, so I want to get right to it. I'll ask our panelists to activate your cameras and come off mic as I call on you. The first question is to Louise. I know that you brought up earlier in your presentation that the rules engine was changing every 7 minutes as the pandemic was evolving. Here we have a question from the audience members. So as the science changes and as passes, it becomes more clear that a vaccine might have a period by which an individual is no longer immune. Can you share a little bit more about how these kinds of passes can be revoked or no longer valid based on the different science and the different rules that you might have to implement for an individual that might have gotten a vaccine 6, 8, 9, 10 months ago?
Sure. The requirements are where governments communicate these messages. And so if a government decides that they're no longer going to accept vaccinations that are over 18 months old or 2 years old or whatever it might be, that person will get a not okay to travel message because their vaccination loaded in their wallet won't be sufficient. If they've had another vaccination, a booster shot, whatever it might be in the future, then they can upload that in order to get the most up-to-date information. It works similar there to the passport would if your passport expires. So it's time to get a new credential. We are seeing some countries, our UK is a good example, issuing vaccination certificates with a built-in expiration date. Where it's considered no longer valid in order to be able to roll with any changes as they are discovered.
Thanks, Louise. Next question is for Sandra. So Sandra, an audience member is asking, so given your perspective and all the things that you're hearing from the state of New York, what other countries in Europe do you believe will be accepting the Excelsior Pass and the Excelsior Pass Plus?
The other countries are still under different discussions. There are some countries where the credentials are following some EU standards. We do think that by New York and California being the two anchors of this nation, aligned on the standards, it will push the international conversation and additional countries will fall in. Some of the countries that are using Verify will be able to use the Excelsior Pass Plus in their travel for New Yorkers. So that ranges from Italy, Bahamas, France, El Salvador, Greece, Honduras, etc. So I think part of what's happened with today is it's just moved the conversation a little bit farther along. Similar to when New York was first in the nation coming out with the Excelsior Pass and driving this conversation, and some of the issues that California and others are talking about that they've experienced, it is about, first and foremost, having to have trust with the individual citizens, trust between individual countries, trust between the individual states. That is at the crux of all of this. Also at the crux is the US federal government sets the requirements that govern the COVID vaccination and the testing requirements. So while you have some examples where a country may have an expiration date on their vaccine, we currently have no expiration date on the CDC card issued by the federal government. So, that's a good example of policy evolving and moving in this shifting landscape. When we first came out with the Excelsior Pass, the federal government had guidance that a vaccination would be available for or would be valid for a certain time period, right? That federal guidance on CDC then changed, and we mirrored what the CDC card has, which has no expiration date. So we, like California, are in a position, in Louisiana and other states, we have to follow what the federal government indicates. The issues that Louise raises from her IATA perspective is really speaking to the complexities that each country has in either mandates that have been put on the airline industry themselves, which the airline industry is an economic driver for everything, or it's mandates that individual countries put on those airlines. The airlines are having to comply with a complexity of stuff that will not be figured out, overnight. But somehow we have to come to this commonality and simplify. This is not that complicated, right? This is one of the things where the technology is easier than policy. So where can you also find commonality on policy amongst other nations and within the US states in themselves as well?
Hey, that, Sandra. I have another question here from an audience member, Edem. So from your perspective, with all that's going on in Africa in this space, do you think that once the public health crisis passes, will vaccine passes evolve into something more holistic about the medical information? Are there conversations that you're having with the CDC in Africa around sort of what's next, essentially? The same question I'd asked Rick. Are there other deadly diseases that you would hope to want to leverage this kind of pass for?
Indeed, and as I said earlier, for us, we saw this as a crucial opportunity to transform a crisis into an opportunity to create the e-health screening backbone for the continent. Actually, this was launched way back in October last year, where the ministers of health, ICT, and ministers of transport came together. And the idea was to see how we harmonize. But what we're going forward with is using travel as a starter. Once you get travel data, you get test data, vaccine data, and not including genomic data. We think that these tools, with the kind of machine learning and algorithms we're building into these tools, is going to give us very powerful tools for Africa to begin to now look at how variants come into the continent, how they're moving across the continent, standards that labs are taking to test. And beyond COVID, we're including Ebola, we're including other diseases, zoonotic diseases, so that we're able to issue alerts from different parts of the continent as to where certain disease levels need to be monitored, what kind of travel mechanisms need to be put in place. So we don't find ourselves in a situation where we ever even need to go into the kind of lockdowns that we find ourselves going to. Thank you.
Great. Thanks, Edem. Well, so I know we're a few minutes over. Really appreciate you sticking with us for these 6 minutes past the top of the hour. As you can tell, a lot of going on here, and I hope you found this conversation as rewarding and insightful as I did. Please tune in tomorrow for day 3 of this, where we'll talk about ethics and policies and the implications of that related to international travel and vaccination credentials. So with that, we'll wrap, and thanks again for joining us on this webinar.